Hi, I'm here today with Joanne Chiedi, the Principal Deputy Inspector General for the Health and Human Services Office of Inspector General. Joanne, thanks for joining us.
Thank you for having me, James.
I'd like to dive right in and talk a little bit about data. I know that data is on a lot of people's mind right now, and I know that the OIG makes very, very big use of data. So could you kind of walk us through how the OIG uses data, how it collects it, how it uses it in investigations and audits?
Sure, absolutely. Data is basically, has been now in our DNA for a while. We could not possibly do our job without it. If you think about oversight of Medicare and Medicaid, Medicare alone pays about 1 billion claims a year. So that's a lot of data. So what we have been doing is making strategic investments in our infrastructure, and with the goal of bringing our skills, our authorities, and our tools together. And what we also want to do is ensure that our tools can be used anytime, anywhere by our investigators, our auditors, our evaluators, and certainly for our law firm. Because you have to take the data and you have to pair it with field intelligence. Because data doesn't completely tell the story. It tells the first chapter of what we believe might be going on. If we see spikes in billing behavior, or sudden declines in billing behavior, or just basically we're not sure of what's going on. There seems to be an aberration. And so whenever we see that, we always think first patient, our beneficiaries, which are at the center of everything that we do. So we're really focused on ensuring that those aberrant behaviors aren't impacting or causing harm to our beneficiaries. We've recently hired statisticians, data analysts, and our focus is not just in Washington, D.C., where our chief data officer sits, but it's really across the country. So it's harnessing all of the information that's out there, our intelligence using the data, and then looking for those patterns, which is really critical in anything we do. I think the old way, I've been around where I've seen people use spreadsheets and there's millions of rows of data. That's something that you can't survive in today's world by working that way. It's just you're not going to be able to prevent and detect healthcare fraud or different abuses in healthcare fraud. So it's really building that establishment, committing to it, data at people's fingertips, elevating it to a level where that information provides you information to give you the knowledge and the wisdom to make good decisions, and then for all of our disciplines to share it, to weigh in on what are we seeing here. Is this an investigation? Should we turning it into an audit? Or should we look at it at an enterprise level and evaluate behavior?
Right. Well, that leads me into another question. You talk about the hirings you've done. How has the budget impacted the resources and the hiring ability of the OIG?
Well, the budget is, it's a yearly cycle. It seems like we're always in a budget cycle. And certainly, you have to really have a vision and a solid plan to make investments in technology. Because once you start, it's a recurring cost. It's not something that you can do once and move away from it. So we actually made a conscious decision. We were in a hiring freeze from 2012 until 2014, where that gave us opportunities to put a real solid plan on what IT investments we wanted to make. And we typically, because we're a people organization, we would hire up to the levels that the budget would take us. We actually carved money out to ensure that we had sustainability in our IT infrastructure. Because when we were able to start hiring people in 2014, again, the hiring freeze was lifted, we really was focused on hiring the best and the brightest. You want people to come in, sit at the desk, and just start playing with the data. So we were starving for a while, but luckily we made a compelling, presentation of our budget, and the administration supported it, and the Hill appropriated those dollars. So I'm happy to say we're no longer in a hiring freeze. We're in a really good position. That's
great. Another big issue that's a lot in the news, and I know it's been talked about on the Hill recently is the prescription drug opioid abuse problem.
Yes.
What role is the OIG playing in that? What kind of investigations and audits do you have ongoing?
Right. Yeah. Well, again, I mean, patient harm is always on the forefront. When we see patient harm, everyone drops everything that they're doing and focuses on how we can stop that harm from continuing. We've had a long history of combating opioid abuse, and we're committed to doing that and continuing committed doing it. And our law enforcement group has done a great job providing technical assistance and training to hospitals and pharmacies on how to reduce threat or theft of prescription drugs. So that's had some good impact because you have to know how to detect, like there's pills missing here. Also, drug diversion is on the forefront of our minds, and we're working with our DEA law enforcement partners and working very hard to shut down pill mill doctors as well as pharmacies. And we've had some traction there. In our June takedown of 2015, we've had several arrests in that area. And then we also look at, prescribing patterns and drug interaction potentially with beneficiaries. Because if you go to one specialist, one primary, all of us have gone into either our relative's home, our parents' home, and there's that basket of prescription drugs. And you just wonder how those prescription drugs are going to interact with one another. So we have a lot of work on that, and we're also continuing to look at that. And then, of course, on everyone's mind, because it hits the Benny's pocketbook or wallet, is the payment policies for brand name drugs, specialty drugs, generic drugs. So we're also looking at that as well.
Fantastic. Kind of a final wrap-up question. I know that it's still fairly new with the OIG, the Affirmative Litigation team. How is that working so far? Can you give me an update?
Well, because I'm from the IG community, I'll start with the numbers. So we created the group in really fully staffed to where we can staff it. In this fiscal year alone, in the first 5 months, we've basically returned in financial recoveries $39.9 million, which is fantastic. And basically what the Affirmative Litigation team is focused on are our authorities, our civil monetary penalty authorities and our exclusion authorities. And it's really holding individuals accountable. It's filling an enforcement gap. The U.S. attorneys are great partners, our partners in healthcare fraud. There's a lot of work out. So if we can fill a gap that maybe may not meet a certain payment threshold, then we want to do that with what we can do with our tools, the tools in our toolbox. And also, we're ensuring that enforcing our CIAs, our corporate integrity agreements, which we believe really changes behavior and institutes compliance in industry, and that's what's really needed. Because at the end of the day, we do feel our work weeds out the bad so the good can flourish. And a majority of physicians and hospitals want to do the right thing.
And how big is the team now? Is it expanding?
It's expanding. Now, that's always a loaded question because I'm sure any staff back in Washington is saying we need more. But it's about 10 to 12 right now. I mean, but I would like to see it grow even beyond that. It just makes good sense to do it. And again, it's a deterrent. When folks see that no one can fly under the radar, we're going to be watching, and those attorneys are loving the data. They just consume it, use it. Our auditors help them look at aberrant behavior and abusive patterns. Our evaluators come in and assist, and our investigators. If they see a case that might be under a certain dollar threshold, they refer cases to our law firm. So it's great to be a self-referral agency. I don't have to go far for someone to pick up the ball and take something forward.
That's great.
That is great.
Well, thank you so much, Joanne. It's been a pleasure.
Thank you, James.